FUE technique, micro FUE technique has three steps. The first steps, we extract the grafts with this punch. I use the three different punch, and at this patient I use the gold one. Another one is a standard metal punch, and so it's important part during extractions is a sharp. I prefer the sharp punch at the patients, because when if I use the sharp punch, the risk of the disturb of the graft is lower than another one, and so the decision of the diameter of the punch is important. In my clinic, I prefer the thin hairs. I generally use the 0.7 diameters and 3 millimeters length of the punch. And so if the patient's graft follicles or graft is thick, I prefer the 0.8 punch. And also sometimes the length of the graft is so long. In this case, I generally use 3.5 millimeters punch, and we can perform the extraction easily and safely with this length and diameters. And don't forget it, and the decision during the surgery, length and diameters is so important. And also always the sharpness of the punch is the company quality, and the metal quality is so important. So the company is so important at the operation, because the lower quality punch is not effective extractions. 3 point is so important. Sharpness of the punch, length of the punch, and the diameter of the punch. If the surgeon, experienced surgeon, know that all of the patients is different, so experienced surgeon decide which sharpness, length, and diameter they decide that, and then it's so easy. After the extractions, we extract the grass, and so we clean the grass without any blood, anything else, and we split the grass. We spread the grass, one follicle containing grass, and also 2 and 3 follicle containing grass. It's so easy for doing the implantation, because if I make a natural appearance, we always use the one follicle containing graft, the front region, and another one to another area. We prefer the 2 and 3 follicle containing grafts. It's so important to order the grafts also.
At the procedure of the hair implantation at microfluoride FUE, firstly we finish the extraction phase and we order the grafts. We take around 3,000 grafts at first step, and if the patient's baldness area is big, and so we divide the operation 2 sessions. At first step, we will cover the front region with 3,000 grafts. Another day, tomorrow, we will again around 3,000 grafts to cover the rest of the up and the back region. And this step, we will open the holes with, using the lateral slit technique. And especially front region, I use a one follicle containing graft. That's why I give the maximum density to front region with direction of the own hairs. It's so important for the naturality. And also some cases I use the DHI FUE, and some persons you use the terminology just DHI, but don't forget it, DHI also the part of the FUE technique. And so the density is same. There is no differences between the DHI technique and also micro FUE technique. And there is some advantages and disadvantages of the patients. And generally, I use the DHI especially without shaving patients. But the lateral slit technique is, I think that's better than the totally bald patients, because the density is not different between each techniques. And at this part of these patients, I must arrange the length of the grafts and slits, and also diameter at the slit is so important. And the blood circulation also so important when I open the holes. And so a lot of patients is vascularity of the skin is different, and there is no standards of the open the holes, because yes, there is a basic standards. We make the holes with this zigzag fashion, but the density is changed all of the patients. And like this patient's skin is very good. We can open the holes very easily, and but the standard limits of this operation is we don't disturb the blood circulation of the skin, and also we don't result in a skin necrosis after this operation. And also don't forget it, the venous deficiency result in a graft losing, and we must pay attention to all these keys is so important. And then so we don't forget that each touch is decrease the blood circulation of the skin. That's why I generally use my key point is once I open between 25 or 30 holes per centimeter squares is my key point. And if I try to more density at these points, sometimes result in a skin necrosis or venous deficiency, so result in a graft losing, and so decrease the operation success rate. It's so important. And always we talking about the hair implantation techniques, and so this important who perform the surgery, and so, but generally we never talking about our devices, instruments, and also the instruments help us so much. And the high quality contemporary devices is so important at hair implantation. And you know that there is a lot of techniques that we prefer generally use the FUE technique. FUE technique is follicular unit excision technique, is especially the first step of the
our punch. The punch is so important. The recent literature show us that the blade sharpness of the punch is so important. Especially, we prefer the threaded punch for the sharpness. The sharpness of this threaded punch is longer than the straight punches. Is so important, and we use the surgeon choosing of the punch diameter in the length of depends on the patients, the skin quality, skin tenderness, skin laxity is so important at the punch because especially and always we can change the punch number, length, also diameter. In my clinic and at the curve hairs and also African hairs, also thick hairs, I generally use the 0.8 punches. But if the patient's hair is thin, and we generally use the 0.7 punch diameter. But another part of the point of at the hair implantation during choosing the punch, punch and the length of the punch. Some patients' grafts is so long. In these cases, we prefer the 3.5 millimeter length. But if the normal patients, we generally prefer the 3 millimeters punch. Punch length and the diameter is so important during the excision, but not during excision is not important. Is just important. Another part of when we excise the grafts, the extraction devices is so important. The handful and also the so comfortable machine is so important for the surgeons. Another part of during the implantation. Implantation is angle of the our devices is, and also softness and also comfort is so important at the surgery. So certainly the most important phase of the FUE technique is surgeon. Certainly surgeon is important, but we always forget our devices is another part of the importance, because we can do this operation with our devices. Thank you so much.